Do you know how much your whole family spent on medical costs last year? You might have a rough idea of what you pay each month for your premium, but what about everything else? Your deductible, copays, and those extra payments that come after you meet your deductible. This chart shows the total annual medical expense, a chart that illustrates the complete breakdown of your medical costs through a year. It's a crucial concept we aim for you to fully grasp. At first, it might look unfamiliar, but don't worry. We'll keep coming back to this chart throughout the series and explain exactly how it works. For now, just take a quick look and get comfortable with the idea. By the end of the series, this will all click, and you'll be able to see the bigger picture of your true annual costs. And once you do, you might realize there's a plan out there that fits your needs and your wallet a lot better. So let's get started. Today, we are going to talk about the U.S. health insurance system. There's already a ton of information out there explaining all the ins and outs, but what we are going to focus on is giving you the lowdown so you can tell if you're making the right health insurance choice. Instead of just explaining how it all works, our goal is for you to be able to figure out if your insurance choice provides the best value, and if not, how to pick the best fit for you. This is the first session in a series designed to give you a solid starting point. Later sessions will dive into comparing different health insurance options, and by the end, you'll be all set to find the best plan for you and your family. There's no single best plan out there, because what's ideal really depends on your unique situation. While we won't tell you exactly what to choose, we will arm you with all the crucial info so you can make that call on your own. So here's a summary of what we'll be going through today. Topic 0. This section provides a brief explanation of what health insurance is and its benefits. If you are already familiar with the basics, feel free to skip ahead to Topic 1. Topic 1. While you may have encountered the U.S. health insurance terms before, we'll quickly review 5 essential insurance terms and their characteristics. Topic 2. This crucial section focuses on understanding how U.S. health insurance operates from an annual cost perspective. We will visually demonstrate what you pay, what you could pay, and the potential total annual cost. Topic 3. We will explore how your share of medical costs is determined, illustrating the division of payments between you and the insurance provider. Now, what this video won't tell you is whether you should have health insurance, or dive into the different types of health insurance plans available. Those are big topics for separate discussions. So, if you're looking for an answer on which plan to choose, or should I even get insurance, those answers will come as future topics. Today, it's all about building that foundational understanding. If you're watching this part of the video, chances are you're either exploring health insurance for the first time, or you already have it and are trying to make sense of all the details. Understanding how the U.S. health insurance system really works is confusing and is like walking into a maze, right? But at its core, its purpose is simple: to help you and your family afford medical care, and, crucially, to protect you from the financial shock of high healthcare costs. There's a wealth of information available, with many resources explaining the what and why of your medical payments. However, few truly focus on your total annual medical expenditure. Are you maximizing the value of your payments? Do you even know how to determine if you are? Let's see if you can answer these questions. What is your potential annual minimum and maximum payment? What were your total medical costs last year? Based on your medical activities last year, was your chosen plan the most beneficial option? If you can answer these questions, this video may not offer you new insights, so feel free to stop watching. Our goal is for you to walk away with a basic understanding of the U.S. health insurance system, and more critically, to grasp your minimum and maximum out-of-pocket payments for any given year you're insured. This baseline knowledge will empower you to make informed decisions when choosing a health insurance plan for yourself and your family. So, let's move on to the first topic, Topic 0. What does health insurance do? It plays several key roles. First, it's your financial protector, covering a significant portion of your medical expenses. This translates to lower out-of-pocket costs for things like hospital stays, prescription medications, and even those routine checkups. Second, it ensures access to care, empowering you to get the treatment you need without the overwhelming fear of crushing bills. Most plans also prioritize preventative care. Think vaccines and screenings, designed to keep you healthier over time. And here's a big advantage. For preventative care, your insurance often covers the cost without you having to meet any conditions. That's huge if you'd rather focus on preventing issues at no cost, instead of paying after an issue comes up. They cover emergencies, of course, and many provide crucial support for managing chronic conditions like diabetes or heart disease. And in some states, having health insurance isn't just a good idea, it's a legal requirement under the Affordable Care Act. The ACA's individual mandate, which required most Americans to have health insurance or pay a penalty, was effectively eliminated at the federal level starting in 2019, and a handful of states have since established their own individual mandates. In real life, let's be honest, insurance often feels like something we just have to have. And here's the crucial catch. If you don't choose a plan that truly fits your or your family's actual health needs, you could end up paying more than you should without getting the coverage you really need. The difference between having health insurance and not having it is easy to imagine, but understanding the difference between an ideal plan and a suboptimal plan isn't as straightforward. In both cases, you'll have coverage, but are you in the most cost-effective plan? Determining that is what we want you to understand. To truly make the most of your plan, you first need to understand the fundamental language of insurance costs. There are 5 terms you absolutely need to get familiar with: premium, deductible, copay, coinsurance, and out-of-pocket maximum. Let's break them down. Think of your premium as your membership fee. You pay it every single month just to keep your coverage active, regardless of whether you even see a doctor. It's the absolute minimum you'll spend each year on healthcare. Next, your deductible. This is the amount you pay entirely out of pocket for covered care before your insurance even starts to seriously contribute. Until you meet that deductible, you're responsible for covering the full but discounted cost of services. Why is this still useful, even before it's met? Because even then, your insurer has already negotiated lower rates for you. Without insurance, you'd face the full sticker price and have to haggle for a lower price yourself. A copay is a flat, fixed fee you pay for specific services. Imagine a $25 visit to the doctor or a $10 prescription refill. Some plans apply copays even before you meet your deductible, others don't. It entirely depends on the specifics of your policy. Once you've hit your deductible, coinsurance comes into play. This is the percentage of the cost you share with your insurer. So, if your coinsurance is 20%, you pay 20% of the bill, and your insurer pays the remaining 80%. It's different from a copay, which is a fixed dollar amount. Coinsurance is a portion of the bill, and it continues until you hit your maximum spending limit. Understanding coinsurance is crucial for effectively managing your healthcare costs and making informed decisions about your health insurance coverage. It highlights the shared financial responsibility between you and your insurer once the initial deductible hurdle has been cleared. And that brings us to the out-of-pocket maximum, or OOPM. This is the absolute most you'll pay in a single year for covered services. This crucial figure includes everything you've paid in deductibles, copays, and coinsurance. Once you hit that number, your insurance takes over and pays 100% of all covered costs for the rest of the year. It's your ultimate financial safety net. Let's break down your costs into 2 categories: fixed costs and variable costs. Your premium is a fixed cost. You pay it no matter what, simply to keep your plan active. Everything else, your deductible, copay, and coinsurance, these are your variable costs. They fluctuate depending on how much and what kind of healthcare service you actually receive. Now putting all of that into a pictorial view, this is where it all comes together. The absolute minimum you'll spend in a year is your premium. The absolute maximum, that's your out-of-pocket maximum. So, your total annual costs will land somewhere between those 2 numbers, entirely depending on your health needs that year. Here's how your out-of-pocket costs typically play out throughout the year. At first, when you use medical services, you'll likely pay the full but discounted cost until your deductible is met. After that deductible is satisfied, you start sharing costs with your insurer through other copays or coinsurance. And if your total payments reach that out-of-pocket maximum, your insurer pays 100% for the remainder of the year. When you receive a medical service, what you will be paying out of your pocket will be determined roughly following these steps. We have already covered steps 3 to 6, but notice steps 1 and 2. Now, let's talk about how your final medical bill is actually determined. Unlike buying groceries, there's no clear price tag at the doctor's office. You often don't know exactly what you owe until the entire process is complete. Here's what happens behind the scenes. Step 1. The provider sets an initial list price for the service. Step 2. Your insurance company negotiates that price down. This becomes the negotiated rate or allowed amount. This is a crucial step. Insurance companies and healthcare providers, like doctors and hospitals, enter into contracts agreeing on these discounted rates. These negotiated rates are often significantly lower than the provider's full list price. Providers who agree to these rates become in-network providers, and you generally pay less when using them. Out-of-network providers don't have these agreements, so they can bill at full price, and your insurance may cover less or even nothing. Step 3. You pay the full negotiated rate until your deductible is met. Step 4. After the deductible, you then pay either a copay or coinsurance, depending on the service. Step 5. Everything you pay counts toward your out-of-pocket maximum. Step 6. Once you reach that max, your insurer pays the rest. After you receive a medical service, you'll receive an explanation of benefits, or EOB, from your insurance company. It will include information on all 6 steps. So if you have one, take a look at it and see if you can find the information in each step. Important: the EOB is not a bill. It just shows what your provider charged, what your insurer paid, and what's left for you to potentially pay. The actual bill will come directly from your provider. So, that brings us to the end of this session. Let's recap what we covered today. First, we explored 5 key health insurance terms: premium, a fixed cost, and deductible, copay, coinsurance. Variable, out-of-pocket costs that count towards your out-of-pocket maximum. Second, by aligning these terms with an annual payment perspective, we understood that your minimum annual medical expense will be your premium, while your maximum will be your out-of-pocket maximum. Third, we examined how your out-of-pocket cost is determined. Your insurance company negotiates a negotiated rate or allowed amount with the medical service provider on your behalf. This negotiated rate then serves as the basis for calculating your deductible, copay, and/or coinsurance, depending on your current stage of medical expenses. Possessing a deep understanding of these terms, their characteristics, and their interrelationships is incredibly powerful. This knowledge will enable you to select the optimal plan, prevent unexpected and unwelcome bills, and effectively manage your healthcare expenditures. By looking at the fixed premium and potential variable out-of-pocket payments from an annual perspective, you can understand your true minimum and maximum medical costs for a given year. Now that you have the basic understanding of how the U.S. healthcare costs are structured, you're ready to look into the different health insurance plans available to you and choose the most probable one for you and your family. Get ready for our upcoming series comparing various real-world health insurance plans. You'll be amazed by visual graphs illustrating each plan with actual numbers, allowing for a clear comparison of fixed and variable cost thresholds. Don't miss them.